Ms. B.
Hi.
I'm Taylor. I'm a physician assistant student.
Nice to meet you.
So, what brings you in today?
So, I just have this awful headache. Just won't go away.
How long have you had this headache for?
For a day.
Okay. What were you doing when you first had this headache?
I just got up and my head just started pounding in the morning. It just hurts.
Okay, so it happened when you woke up and got out of bed?
Yeah.
Okay, does anything make it better?
Well, I just kind of want to just lay down. I think that would make it better.
Okay, what about, does anything make it worse?
Yeah, these lights and I don't know, maybe loud noises. Like when I got out of my car to come in here, it was really loud.
Okay. Have you noticed anything with the progression? Has it gotten any worse or has it stayed the same since it came on?
When I first got up, it was a little painful, and now it's really painful. So I guess it's been progressing.
Okay. And have you ever experienced this type of headache before?
Yeah.
How frequently?
Maybe once a month.
And what words would you use to describe this headache? Is it sharp? Is it dull? Is it pounding?
And throbbing. I guess would be a good word.
Okay, and does it radiate anywhere outside of your head?
No, it's just my left side of my head.
Okay, can you point to exactly where the pain is?
Right here.
Okay, and on a scale of 1 to 10, 10 being the absolute worst pain, 1 being no pain at all, how would you rate this headache?
Probably a 7.
Okay, and is it constant or does it go away sometimes and come back?
Constant.
Okay. So now I'm just going to ask you some yes and no questions.
Okay.
So have you had any recent head injuries?
No.
Any head injuries in the past?
No.
Okay, and do you have any dizziness?
I mean, when I get up, I'm pretty dizzy, but once I get my balance, I'm okay. But that's just when I have the headaches, when I get up.
And what about lightheadedness?
Not really.
Okay. Have you done an eye exam recently?
No.
Okay, and do you wear glasses or contacts?
Contacts?
Have you noticed any changes in your vision recently?
No.
Any pain in the eyes, redness, tearing, any spots or specks in your vision?
No.
Any history of glaucoma or cataracts?
No.
Okay. And just some general questions. Has your weight changed recently?
Not that I am aware of.
Have any of your clothes fit any looser, more tightly?
No.
Have you been experiencing any weakness, fatigue,
No.
any fever?
No.
Do you have any stiffness in your neck?
No.
Any lumps or swollen glands?
No.
Okay. Do you take any medications?
Yeah. I take birth control,
Okay. Do you know what type or?
Dimera.
And do you know the dosage of that and frequency?
I don't really know the dosage, but I take one pill a day.
Okay. And what route is it taken? Orally? Or?
Orally, yeah.
Okay, anything else?
Yeah, I take this multivitamin in the morning.
Okay. And anything else?
Nope.
Do you take anything when you get these headaches?
Sometimes I take ibuprofen, but it doesn't help. So
Okay.
I don't even bother, but you can write it down because I've taken it before.
Okay. What about allergies? Do you have any?
Not seasonal or seasonal allergies. Yes, I have.
Okay.
Other than that, no.
What are your symptoms associated with your seasonal allergies?
My nose itches, and I just get like lots of like runny nose and like sinus pressure in my front of sinuses
Okay.
here, you know.
Okay. No other allergies?
Nope.
So now I'm just going to ask you some questions about your past medical history. Do you know if you're up to date and got all of your childhood vaccines?
Oh yeah.
You got them all?
Yep.
Have you ever had any childhood illnesses like measles, mumps, rubella, whooping cough?
Nope.
Chicken pox?
I had the chicken pox.
You had the chicken pox?
Yep.
What about rheumatic fever, scarlet fever,
Nope.
polio, diphtheria,
No.
any psychological conditions or disorders? Okay. You said you're up to date with all your vaccines. What about adult illnesses? Have you ever had thyroid disease?
No.
Heart disease?
No.
Hypertension?
No.
Hyperlipidemia?
What's that?
Like high lipid levels in your blood, high cholesterol?
No.
Diabetes? COPD or asthma?
Nope.
Cancer?
No.
HIV?
No.
Hepatitis?
Nope.
Kidney disease? Blood clots? And you said you have no psychiatric history?
No.
Okay, and have you gotten your flu vaccine this season?
Well, not this year, but I got it last year.
Okay.
I don't think it's out yet, but I don't know.
Okay.
I have to get it for my job, so I just get it when they give it to me.
Yeah, that's
You
a
know?
good thing to get every year.
Yeah.
Have you gotten a hepatitis B vaccine?
Yes.
And what about zoster
Yes.
and pneumococcal?
Yep.
Perfect. So have you been diagnosed with any medical illnesses other than the ones I listed?
Not that I can think of.
Okay, and have you ever gotten in any accidents or had any injuries in the past?
Yeah, I broke my ankle when I was 16.
Okay, do you know what year that was? Or
2010.
okay. And how did they treat that? Did they just put a cast on it?
I had to wear this boot thing.
Okay. You didn't need surgery or anything?
No, it was just like they said it was a mild fracture or whatever.
Okay.
So,
which ankle was it?
my left.
Okay. And you don't have any complications?
Nope. It healed fine, they told me.
Okay. Any other accidents or injuries?
No, not that I can think of.
Okay. Any hospitalizations?
Nope.
What about surgeries?
Yeah. I had to get my finger worked on because when I was little, I got it like chopped up when I was playing with the what's that called, mower. When I was playing with the mower, I got it like ripped, so they had to go in there and do some things and fix it up.
Okay. Do you know about what year that happened or how old you were?
I think it was like 2002. My mom was so pissed.
Yeah. It's really sad.
Yeah.
But you don't have any further complications to this day, or do you have full range of motion? Or?
Oh yeah. Yep. They fixed me right up.
And do you know what hospital?
Bronson?
Do you know the surgeon's name?
No.
Okay. So now I'm just gonna ask you some health maintenance questions,
Okay.
just to see how you keep up with your medical care. Have you gotten your cholesterol checked recently?
No.
Do you get mammograms?
No.
Tuberculosis testing?
TV, yeah.
So when was the last time you had a TB test?
In March this year.
Okay, and then what were the results?
Negative.
Okay, have you gotten a pap smear recently?
Every year.
Perfect. Okay, now I'm just gonna ask you about your menstrual history. What was the age when you got your first period?
It was like 13.
Okay, and what was your last period?
Oh. 2 weeks ago?
And how many days do your periods usually last?
3.
Okay, and is it regular or?
Yeah.
Okay. And have you ever been pregnant or have had any kids?
No. Maybe one day.
Okay, you said you take birth control.
Yes.
So are you sexually active?
Yeah.
And how does your partner describe their gender?
Yeah.
Do you use any protective barriers?
Sometimes.
What kind?
Condoms.
And have you been intimate with anybody else?
I mean, I've been with 2 different guys in the past, like, 6 months.
Okay. Do you have a history of sexually transmitted infections?
No.
And how do you feel like your relationship is with your current partner? Like, how would you describe that?
Yeah, we're just having fun, I think. It's going pretty good so far.
Can you feel safe when you're around him?
Yeah.
Okay. Feel respected?
Yeah, he's super cool. He's nice.
Do you have any questions or concerns about your relationship or your sexual activity?
Not really.
And you said you have no psychiatric history. Okay, so now I'm going to ask you some questions about your family. So this would include grandparents, parents, siblings, and you don't have children or grandchildren. Has anyone in your family had headaches?
No.
Seizure disorder? Stroke?
My dad had a mini stroke, is what they call it.
Okay.
I think it was like 5 years ago. But he's still alive.
Okay, and how old is he?
He is 57.
Okay. He's the only one in your family who's had a stroke?
Yep.
Okay, any mental illness in the family?
No.
Any ideas of suicide?
No.
Substance abuse?
No.
Thyroid disease?
No.
Coronary artery disease?
My grandma, she has, or had, I guess, CAD.
Okay, so she passed.
Yeah.
I'm sorry to hear that. How old was she when she passed away?
89, just last year.
Oh, I'm sorry.
It's okay.
Any history of hypertension?
Yep. My dad has it. And my grandpa has it.
Okay. Is your grandfather still living?
Yes.
How old is he?
He is 84.
Okay, what about hyperlipidemia, high cholesterol,
I don't think so.
diabetes?
Diabetes, yeah. What was the question?
Diabetes.
My grandma had diabetes, the one that died
Okay.
too. And she had cancer too.
Okay. What kind of cancer?
Liver.
Any family history of asthma?
No. My grandpa also had melanoma.
Your same grandfather with a liver condition?
Yep.
Any history of asthma?
No asthma.
Tuberculosis?
Nope.
Renal disease?
No.
Arthritis?
No. Sorry.
Allergies?
No.
Cancer?
Other than those two cancers, my uncle had prostate cancer.
Okay.
I don't know if that's related to me.
Have your mother or your father haven't had any?
No.
Okay. Any genetically transmitted diseases in your family?
No.
So does your mother or your siblings or anyone have any other medical issues?
No.
Okay. Does anyone in your family experience symptoms like what you're feeling? These headaches?
No. I'm the only one.
Okay. So now I'm just going to ask you some questions about your social history so I can learn more about your daily life.
Okay.
So where were you born?
South Haven, Michigan.
Okay. What was your childhood like? What are your thoughts when you think about it? Was it pleasant or?
Yeah, pretty pleasant.
When was your last year of schooling completed?
2012.
Okay, and was that college or?
College.
What's your occupational history?
I'm a nurse.
And how's your home life? Where do you live? In an apartment, in a house?
I live in a house with a dog.
What's your dog's name?
Spade.
That's fun. I love dogs.
Me too.
So you said you have a significant other?
Yeah, he doesn't live with me though.
Okay. Do you have any sources of stress in your life?
Work's pretty stressful as a nurse.
Yeah.
I'm on my feet 24/7,
Yeah.
12 hours a day. And, sometimes like taking care of like really sick people just really puts a damper on your day,
Yeah, I totally understand. Have you ever been in the military?
No.
How's your financial situation?
I mean, pretty stable. Yeah. Got a good job and a good house, so.
That's awesome. What do you like to do for fun?
I like to go to movies, sports, like baseball, football, basketball.
What's your favorite team?
I like Michigan State, Spartans.
Is that where you went to school?
Yeah, it was really, really fun.
Okay. Do you have any issues doing activities of daily living such as bathing, dressing, toileting?
No, I'm pretty good with
Are you good with using the telephone, shopping, preparing food?
that. Yeah.
You take your meds?
Yeah. I only take like birth control, so I
Yeah.
have to remember that.
Yeah, that's really
Yeah.
important.
Yeah.
Do you have any religious beliefs or spiritual beliefs?
No.
Do you exercise?
Yeah. 5 times a day.
What times a day?
Or a week. 5 times a week. That'd be a little excessive.
That's what I was thinking.
Yeah.
What kind of exercise do you do?
I just go to the gym. I like to switch it up between lifting weights and running.
Okay. And how's your diet? Do you eat normal or?
I would say like twice a day, but sometimes when I'm at work, I can't even eat until like 4 because it's so busy. So I mean, the days that I have off, I eat pretty regularly. So.
Okay, what about fluids? Do you drink water or?
Yeah, I try.
Okay, what about caffeine?
Yeah, I drink lots of caffeine, coffee.
And how do you sleep at night?
Pretty well. I don't really have any troubles with that.
How many hours a night approximately?
Anywhere between 6 to 9.
Okay, now I just have some safety questions that I feel like I should ask every patient just to make sure. Do you wear seatbelts?
Absolutely.
What about a bike helmet?
Yep.
Sunblock?
Yep.
Do you have smoke detectors in the home?
Yes.
Do you have any firearms in the home?
No.
And do you have any issues with your significant other, your boyfriend, or is everything good between you two?
No, pretty good.
Okay. Do you ever use tobacco?
No.
Have you ever used it in the past?
No.
What about alcohol?
Yeah, I drink.
How much do you drink when you do drink?
Like once a day.
Once a day?
Or like one glass a day, I guess.
Okay. What kind of alcohol?
Maybe like I can switch between like wine and beer.
Okay. Do you use any drugs that aren't prescribed to you? Anything? Marijuana, cocaine?
No.
Okay, now I'm just going to ask you some more yes or no questions. Just make sure I didn't miss anything.
Okay.
Have you noticed any skin rashes, lumps, sores?
No.
Any itching, dryness, change in color, change in hair and nails?
No.
Change in size or color of moles? Do you see any flashing lights?
No.
Do you have any hearing issues?
No.
Any ringing in the ears, vertigo, earaches, infections, discharge? Do you use hearing aids?
No.
Do you have frequent colds?
No.
Any stuffiness or discharge in the nose?
No.
Any itching in the nose?
No.
Just when you have your allergies, right?
Yeah.
Okay, and any nosebleeds?
No.
And you said you have sinus trouble when you have allergies too. For your throat, have you noticed anything different with your teeth or gums?
No.
No bleeding with the gums?
No.
When was your last dental exam?
It's March 2018.
Okay. Do you have a sore tongue?
No.
A dry mouth?
No.
Frequent throat sores? Hoarseness?
No.
Have you noticed any? Do you do breast checks, or have you ever gone for a mammogram? Have you noticed any lumps, pain, discomfort,
No.
nipple discharge,
No.
self-exam practices you do?
Yep.
Have you noticed? Have you had a cough?
No.
Any sputum?
No.
Shortness of breath?
No.
Wheezing?
No.
Pain with a deep breath?
No.
Asthma?
No.
Bronchitis?
No.
Emphysema?
No.
Pneumonia?
No.
Tuberculosis?
No.
Have you ever had any heart problems?
No.
You don't have high blood pressure? You have a heart murmur? Any chest pain or discomfort?
No.
Any palpitations?
No.
Shortness of breath?
No.
Do you need to use more pillows at night to ease breathing? Have you noticed any swelling in the hands, feet, or ankles?